The other side of the hazards of needling is, of course, contraindications. Are there people that you would not needle or that you'd be more cautious about needling?
Yes, I think that the first one I say is someone who's needle phobic, someone who says, absolutely don't want needles, I would not force the needle on them. But certainly somebody with an anticoagulant, not aspirin and not an anti-inflammatory drug, but one of the currently available anticoagulants.
So warfarin, for example.
Warfarin is the old one that's used, yes. And there you have the INR as a guide, so you like to have that under 2 before needling. But there are the newer anticoagulants that do not use INRs, and so you can't tell, but I just wouldn't do that. I would use a manual or alternative technique. There's cold laser techniques, there's electroshock wave therapy, plus a variety of manual techniques. So there are alternative ways to treat. I would not treat an area that's infected that wouldn't go through cellulitis. I wouldn't treat an area that is known for cancer or tumor, or one that's undergoing radiation therapy where there is an impairment of circulation in that area. I would not treat an area of lymphoedema, for example. So that these are, now, is a prosthesis an artificial knee a contraindication? I think not. You have to realize that anything that's implanted in the body is a ready focus for infection. So I think you really make an effort to clean the skin, scrub, so when you put that needle in. Dry needling is a clean technique. It's not a sterile technique, but it's a clean technique. And the other real concern is pregnancy. We have heard people say that pregnancy is a contraindication. Dry needling can induce labor and miscarriage and so on. There's absolutely no evidence. We've looked at the literature, we have talked to OB-gynecologists. There is no evidence that needling of any sort will activate labor and lead to miscarriage as a complication.
It's always struck me as slightly peculiar that when it suits the conventional medical world, they will blame physical therapy or acupuncture for accidents. But if you're telling them you can help with inducing labour, they'll say, well, there's no evidence that that could possibly work.
A woman with low back pain, pregnant woman with low back pain, you need to treat the low back pain. I think it's fair to go ahead and do that. The problem, of course, is that especially early in pregnancy, miscarriages are rather common. Yeah. And if you happen to treat somebody a day before a miscarriage, you are responsible for the miscarriage.
In their mind, yeah.